Hello and welcome. This is Kareena Kapoor Khan, here to salute the unsung Corona warriors. Mrs. Sangita Reddy, a global healthcare influencer, technocrat and social entrepreneur. She is the joint managing director at Apollo Hospitals, apart from being on 16 different boards and country's greatest policy councils. A humanitarian, a leader, especially when it pertains to the future of healthcare. Please welcome Mrs. Sangita Reddy. Mrs. Reddy, thank you for coming on the show. It's an absolute pleasure to be talking to you right now.
It's a pleasure to be here, and of course, wonderful to see you.
My first question is, as a healthcare professional, what kind of challenges have you had to face with regards to managing resources and keeping your staff safe?
I think the biggest challenge really was about mindset. It was about mindset of the staff, because they had to overcome their fear. And I must say, the Apollo team and many healthcare individuals across the country and the world have just been amazing. After that, procuring material, planning manpower, creating facilities, innovating with science, technology, new Indian manufacturers, working with the government, all that kind of flowed through once we had set our minds on the fact that we have to fight, we have to win this battle, and we must save every life.
Lovely. Obviously speaking about medical professionals, I personally feel that they're beyond superheroes. I think they are they're just gifted with something that, I think that what we don't have, I don't know. I just feel when I look at the doctors, nurses, I think I'm looking at them in a completely different light after this whole thing, because what they have gone through, what they are going through, the healthcare workers, it's just absolutely amazing. So what do you think that is their biggest strengths and weakness in this regard,
So clearly for India, I think, like you rightly said, the fact that they are the angels in white, and the fact that many people, starting from the Prime Minister, began to acknowledge this, like you beautifully said. I think that acknowledgement, that appreciation, that respect in society is one of the most important things for a healthcare professional. And so when you say, we respect you, we regard you, we're here to support you, we will listen to your guidelines, that does half the inspiration. The biggest strength that India really has, I think, is its demographic, is some great leadership which emerged across the country, from Prime Minister to, other secretaries, ministers at healthcare, and nursing leaders, sanitation workers who stood up there and said, so leadership is not just about being a neta or being a CEO. Leadership is about showing the way to people and showing the right way. And I think that has been one of India's greatest strengths, that so many people stood up to be leaders in their realm. And I think people like all of you, public figures who stood up and acknowledged the role of healthcare, used your popularity and your voice to convey the right messaging. That also was important and is critical, because see, India's numbers, if you look, our death rate at 2.8% versus the global death rate of 5.9%. The fact that people live in conditions like, you're seeing unfortunately in Mumbai and Dharavi, but also slums across the world, across the country. The fact that living conditions are not conducive to social distancing and safety is a significant factor that, it is going to be one of our weaknesses in this fight.
Absolutely. Wonderfully said. Mrs. Reddy, you've always been a tech evangelist, especially in healthcare delivery. How do you think technology can be deployed against the COVID-19 pandemic?
Kareena, this is a fantastic question. To begin with, I've always, thought that telemedicine is a very powerful tool. We've used it at Apollo for the last 20 years to find ways to bring the benefit of high technology medicine within the reach of people in rural areas. But now the deployment has been all over. Our app, Apollo 24/7, has had over 13 million people do the risk scoring. We've used it to do teleconsults with doctors where patients could not come into the hospital and doctors continued to stay connected. I think the government, that's really been super cool. And the interesting thing is that we've had this technology for ages, but the adoption just skyrocketed when the need grew. And I think the government app, the Arogya Setu, where you knew if you were going close to a red zone, that's been a very powerful
Right? Absolutely.
technology utilization to help public. The other one is the great role of technology in teaching. We created a course on COVID because it was a completely new knowledge. And over
Yeah, nobody
yeah, you're right. Nobody knew. So over
knew much.
1.6 lakh people from 120 countries went through that e-learning course online. No classroom, no teacher, but knowledge is being transferred. So that was powerful. And now at the request of the government, we've created, everybody has heard that the biggest gap is the ventilators. So everybody moved into manufacturing ventilators, but how do you train people on using ventilators?
Have the knowledge to use. Probably we don't have as many healthcare workers.
Right. So we quickly moved into training anesthetists, general physician, intensivists, and nursing on how to use a ventilator. And that course had course content, a simulator, a Q&A, so you know whether they've really understood, and then an
Right?
online buddy system with the Critical Care Society of India and Apollo intensivists. So these kind of things of using technology to create skill sets in a short period of time.
Absolutely. I think, Sangeeta, what you said about the ventilators is such an important point that you've made, that you all are training people, and there is this buddy app which is going to where they're going to answer questions, so their knowledge builds on this. I think this point, I'm so happy that you've mentioned this. You've already said such wonderful things. It's been so wonderful talking to you. But as a global healthcare worker, what is that one message that you want to send out to the nation?
The first one is that we must learn to live carefully and safely with corona. The new normal is about protecting yourself and your vulnerable and your family. The second important message is, as big as this may seem, there's a bigger disaster looming, and that is non-communicable disease. Heart disease, cancer, obesity, strokes, and all these are lifestyle related disorders. And I think
Absolutely.
what has come to the forefront now is that life is precious, and have regular checkups, eat healthy, manage your stress very differently, and just be fit, be conscious, and protect yourself. That because life is priceless.
The conversation that we've had today is also precious and priceless, because you've said such insightful things. It's been absolutely lovely. I'm so glad. Said so many things that are going to stay with me, which I will definitely be sharing with Saif and Taimur. One, small little virus has kind of brought this entire globe together. So happy it brought us together also. Thank you so much, Sangeeta, for joining us and talking to us.
Thank you, Kareena. Absolute pleasure talking to you. And you keep up all the tremendous and fantastic work you and your family does.